My name is Robert Oakes, and I'm in physical therapy for Parkinson's and also the after effects of a brain surgery I had for removal of a brain tumor.
Before my accident, I was throwing the javelin at Stanford. Now, with my condition, I can't do any of those things.
When I first started going to Rise, I was in a wheelchair. My condition impacts my life a lot. I can't do regular daily functions like normally.
Rise Physical Therapy is our flagship practice located here in San Diego, California. When I started in the physical therapy field, I realized that a lot of people go to physical therapy, but they don't get the care that they deserve. The healthcare system is set up for people and providers to fail. Patients would go into practices and not get the care that they needed. So I didn't feel right about giving that kind of care when I was entering into this profession. So I wanted to get in and create a different environment for people, an environment where they spent as much time with a provider as possible, and an environment for providers to be able to have the time and the energy to show their skills and their knowledge in the field. Rise's approach is different from other physical therapy practices because we really spend all of our time with the patient one-on-one. And on top of that, we care about our providers. So what we do is we invest a lot of our time and energy into developing some really high quality providers and giving them opportunities to do things in this industry that many other places wouldn't allow.
Rise, using the technology of the HAL, works with many different types of neurological disorders, including spinal cord injuries, progressive neuromuscular disorders, and stroke.
Regular PT is focused on improving things like strength and flexibility. The HAL technology from Cyberdyne and Rise Healthcare Group is really aimed at improving the neuromuscular connection between patients and their bodies.
The physical therapy I've gotten at Rise has been really beneficial to me, and every time I go I feel a little bit better walking out of there. The HAL treatment is just it does something that nothing else could do. I've really just enjoyed getting my independence back, getting back into where I can walk out in the yard and enjoy playing with the kids more, and now it's a really wonderful thing to be able to get back into that again.
When we're talking about Robert's specific treatment outcomes, we've seen significant improvements in a lot of his walking-based tests. He's managed to not only shave his time by over half, but he's managed to improve in speed, in general safety, as well as just efficiency of his legs.
My first impressions were mixed because with my muscle tone, my muscles don't always do what I want them to do. But with HAL, it provides that feedback to help get that normal movement back.
So Ian suffered a traumatic brain injury about 2 years ago while snowboarding. The sooner that we can get somebody into a device, it can provide a lot more of that neuromuscular feedback to improve these outcomes as fast as we possibly can.
I have a condition called CIDP, chronic inflammatory demyelinating polyneuropathy.
Jasmine's one of our greatest success stories, and she's gotten to a point where she's now able to do a lot of these activities with no assistive device or very minimal assistance. At this point, she's gained a lot of her independence back.
What I enjoy most about HAL is the machine itself. As soon as I get off the HAL machine, I'm walking faster. My feet is walking like I'm going from heel to toe, and now I am walking and standing.
I think a practice that embraces the HAL technology is a practice that really holds themselves to a high standard. Instead of just trying to help a patient or assist a patient, if you really want to improve a patient's function or improve their ability to ambulate, then the HAL is the only technology and the only exoskeleton that's able to support that decision and that value that you hold for yourself and for the patient. I don't think any of us knows what the future of Rise Healthcare Group holds, but I think we do know that all of us are invested in finding ways to help patients, help the healthcare system, and continue to progress forward as individuals, personally and professionally.